Yes, so very good afternoon. Very good evening to all of you. I think we people are online. We can interact with each other through this chat box. So you people must have got a link, like YouTube link. You can just click on that link and please confirm me about audio and video. So if anyone is online, can you please confirm me about audio video? Yes, Dr. Shweta Singh. I can see the name of Dr. Shweta Singh. Yes, Shweta Singh, a very good evening to you. Yes, a very good evening, Dr. Abhinav Bhattacharya. So, guys, we people have come here for a very short session of previous year questions. So I can see all students are our old students. We have already met once during our regular batch lecture. Dr. Nandini, Dr. Nihal, Dr. Sakshi, Dipali, audio video all fine. Thanks for the confirmation, guys. Yes, Dr. Pooja, Dr. VK. So I can see all familiar names. So guys, in this session, I have chosen around 25 to 30 MCQ for you based on the pattern of the last 3 or 4 years exam. Like whatever topics have been covered, I have tried to cover the questions based on those topics. But I also want to know from your side, like what is your expectation out of this session? What do you want me to discuss with you? So I just take another 2 minutes before I start this session. I just want to know your opinion. What exactly you want from us in this session? What is your expectation? Like you people have come here, so I know that you people already have that collection of PYQs with you. You already know the answers of all those MCQs. We'll discuss some important topics over here. So what else you want us to explain in this 1 hour so that you can have the maximum output of this 1 hour? So anyone would like to share his or her expectation out of this session? Anyone? Dr. Swati, Dr. King, Dr. Sharmila, anything expected out from this? Anything expected by you people out of this session? Weight and age क्या है? Doctor, weight and age क्या है? Okay, important topics. Okay, fine. So if we discuss these questions, like you must be knowing in your INI-CET exam, we have usually very less number of questions from pharmacology. So the topic which is very important for your exam is obviously antibiotic topic. So how to choose which topic is important being a dental surgeon? So very simple thing, guys. Whatever cases you people see in your OPDs, whatever drug group you people use in your OPDs to treat your patients. So just concentrate on those groups, right? So just concentrate on the groups which are relevant for your dentistry. Don't try to read those topics which are not relevant to your dentistry. Let's take an example. Like I have received many queries regarding the ophtha drugs. So don't read the topics which you people don't deal with in your OPD. So they never ask any question from the ophtha drug. So if you get any question based on eye drops, if you get any question based on glaucoma, so all these questions are not being asked in your exams in last 3 or 4 years. So try to concentrate on the topics which you actually deal with in your dentistry. For example, being as a dental surgeon, you people must be very familiar. You should be very familiar with the antibiotic topic. So antibiotic is something that you people have to prescribe on day-to-day basis to the patient. So antibiotic topic is important for you. If you ask me, sir, antifungal is important. No, guys, you people don't deal with antifungal, right? So you people don't deal with antifungal. So antifungal is not important for you. So antibiotic is very important. Antifungal is not important except for the one infection. So who will tell me which infection you deal with? Fungus mein. So fungus mein you people mostly deal with oral candidiasis. So oral candidiasis treatment is very important for you. Second problem that you can deal in your dentistry is mucormycosis. So mucormycosis can involve the oral cavity. So mucormycosis, oral candidiasis will be important for you, right? And one more topic that you people deal on day-to-day basis, like even I have suffered from that problem very frequently, that is a tooth pain, the pain in the tooth. So the painkillers. So painkillers are very important for you. The medicines are known as analgesic drugs. So we talk about the analgesic drugs, we have the NSAIDs. So NSAIDs are important. Opioids. Opioids are also very important. So you people prescribe these medicines in OPD. You people prescribe NSAIDs, you people prescribe opioids, as well as you people also give the treatment of neuralgia. You also give the treatment of neuralgia. So these topics will be important for your exam. So you people must be doing these topics in detail, like the antifungal, antibiotics, painkiller. Now, if we talk about antiviral, so being as a dental surgeon, guys, what problem you face as an antiviral? So you people can deal with shingles, right? You herpes we call it, right? So herpes patient can come to you. So patient can have the herpes labialis. So patient can have the problem in the lips. So herpes is an important topic. Similarly, the facial paralysis. So the patient will have the facial paralysis. This may be due to this herpes. This topic is again important for you. And being as a doctor, you people are doing surgery. So if you do the surgery, you know that the patient is HIV positive. If a patient is HIV positive, you are equally at the risk of getting the infection. That's why this topic of antiviral, the HIV treatment, HIV drugs, how to protect yourself, treatment of facial paralysis, treatment of herpes is important. And in case any new viral outbreak will occur like in any year. For example, around 2 years back, they asked the questions on COVID-19. So this time in Delhi, I don't know whether it's there in your state or not, H3N2, that's a swine flu. So this time 69% of the people of the Delhi are infected with this virus, that is H3N2. So this topic has become important for you. You should be knowing the treatment of swine flu, all the medicines that we are using these days against this strain, what are the resistance which we are facing, how we are tackling this resistance, all these things are important. So instead of giving time to the COVID-19, this time you people know that swine flu is like present all over in North India, and this is going to be increased, right? Because the winters are coming up, so this is going to be increased. So this is one of the very important topic for this year exam. So in this way, you have to find out which is important, what is not important for your exam. So this is for the antiviral, antibiotic. The whole topic is important. Antifungal, and anti-helminth is a topic that you people can ignore. So anti-helminth you can ignore, right? And guys, regarding your PCD, right, preventive and community dentistry, mein, you people must be knowing some important programs, like what is the program for the malaria which is going on. So how the government, what are the government recommendation to tackle the malaria? What are the government recommendation to tackle the tuberculosis? What is the government recommendation to tackle the leprosy? So all these programs which government run. So all the government run programs are important for you. So these programs are important. So because as a dentist, you people must be knowing how to tackle with this kind of community problems that we can face on day-to-day basis. So in this way, guys, you people have to find out the important topics. So I hope you have got an approach like how to find out which topics are important, which are not, which you people as a dentist actually have to dealt with in your day-to-day life. Those topics are important. Yes, Dr. Kriti, H1N1 is a usual swine flu, but this time the strain is changed. Like there are two types of swine flu, H1N1 and H3N2. This time H3N2 has become more common. H1N1 is less common. This time in Delhi, like 69 to 70% people are infected with this H3N2. So it's a new outbreak that has started. And you must be knowing like oseltamivir. Who will tell me the drug of choice? Anyone can tell me? So any patient of swine flu will come to you. What is the drug of choice for swine flu, guys? What is the drug of choice for swine flu? Can you please tell me the drug of choice for swine flu? So the drug of choice for swine flu, anyone would like to answer? So these kind of things can be asked. You should be knowing what exactly is going on in these days in hospitals. So यहाँ पे drug of choice is oseltamivir. Oseltamivir is a medicine which is given by oral route. So this is the drug of choice, and this medicine is neuraminidase enzyme inhibitor. So this is the drug which is neuraminidase enzyme inhibitor, and we are using the medicine dose 75 milligram 2 times daily for 5 days. So this is the dose of the medicine. Yes, oseltamivir is a drug of choice. 75 milligram capsule is available in the market. We are giving twice daily, that is given for 5 days. Now the problem which we are facing this time is this is resistant. So the virus is resistant to this drug. So we have moved on to the new medicine. The new medicine is Beloxavir. So this time in India, we are experimenting this medicine, Beloxavir. So Beloxavir is a new medicine. So Celtamavir question they have already asked. So this is a time, this is a high time in INI-CET exam. They can ask you either Celtamavir again as a PYQ, or they can ask you this new medicine, Beloxavir. So Beloxavir is a drug which is endonuclease enzyme inhibitor. So this medicine is endonuclease enzyme inhibitor. This is not neuraminidase enzyme inhibitor. It's a new medicine given for the refractory cases. So it's a Beloxavir that can be asked this time in your exam. So in this way, guys, you have to find out which topics are important in pharma, whatever is going currently, and also whatever is required in your OPD to run the hospital, to run the OPD as a dental surgeon. So those topics are important. And of course, in pharmacology, there is a topic we call it general pharma. So every doctor should be knowing about the general concepts of pharmacology. So in general pharma, they can also ask you two or three topics, and these things are important, right? So let's start with the first topic. Anyone can answer. I can see many of you have answered already. The answer is B, Bombay. So let me tell you, if we talk about the antibiotics, 90% of times, 90% of times, what they will ask in antibiotics. So antibiotics में anyone can answer which antibiotic topic is most commonly asked? Can any one of you answer if we talk about antibiotics? So if you go back to your 5-year questions and have you noticed which antibiotic group is maximally asked? So the answer is beta-lactam antibiotics. So beta-lactam antibiotic is a topic which is very, very important topic for your exam. And in this topic, we have further 4 classes. We have the penicillin group of medicines. We have the penicillin group, cephalosporin group. So these things are important, like penicillin, cephalosporin. Every year you can expect 1 or 2 MCQ from this topic. So penicillins, cephalosporin, carbapinims. So these topics are important for your exam. And number 4 is your monobactam. Now out of these 4, monobactam has never been asked in your exam because it's the least important topic here. But these 3 you have to concentrate. So beta lactam is the most important topic that you people have to read. Number 1. Number 2, you must have noticed in last 4 or 5 years, they have asked you the teratogenesis caused by antibiotics. So teratogenesis caused by antibiotic is very, very important topic they have asked in last 4 or 5 years. They frequently ask this topic, like whenever you give antibiotics to children, whenever you give antibiotics to pregnant females, what all problems can occur. So teratogenesis caused by antibiotic is very important. And guys, if you have attended our regular batch lecture, you must be knowing we have discussed the antibiotic under 6 subheadings. So under 6 subheadings, we have discussed this topic. So in side effects of antibiotics, we have discussed this topic of teratogenesis, like how the antibiotic can affect the growth of the fetus, and all these things are important. Number 3 thing they are asking about from you people is the pharmacodynamics of antibiotics. So in pharmacodynamics of antibiotics, they ask you antibiotic combination. So what will happen when you combine the antibiotics? This is important, antibiotic combination. Second, they can ask you about which antibiotics are bactericidal, which antibiotics are bacteriostatic. So this is also important. And they have also asked you which antibiotics follow concentration dependent killing, which antibiotics follow time dependent killing. This is all been covered in pharmacodynamics. So all these things can be asked in your exam. Of course, they can ask you the antibiotic indications. So antibiotic indications are also important, right? Penicillin resistance, yes. So resistance, you can see here, they are asking which is an irrational combination. So guys, you must be knowing selbactam, tazobactam, clavulanic acid. All these medicines are beta-lactamase enzyme inhibitor. All these chemical compounds are beta-lactamase enzyme inhibitor. So we should combine this beta-lactamase inhibitor only with beta-lactam antibiotic. There is no rationale of combining this beta-lactamase enzyme inhibitor with tetracycline. So tetracycline is not a beta-lactam antibiotic. So we have to protect the beta-lactam antibiotic by combining with beta-lactamase inhibitor. That's why the answer here is B, Bombay. So rest of the medicines, you know, ceftriaxone is a cephalosporin, piperacillin and amoxicillin are the penicillin. Dr. Sujay, we have discussed that CDK is concentration dependent killing and TDK is time dependent killing. So in this way, they ask the question. So I've taken one question from the last year exam of yours, right? And I have taken the other questions also. You can see here. which beta-lactam is not given as a single therapy? So again, this question you can see this is based on beta-lactam antibiotic. So beta-lactam antibiotics ke, again you can see the second question. What is the answer of this MCQ, guys? Which beta-lactam antibiotic is not given as a single drug, always given in combination? So which beta-lactam is always given as a combination? So this is the carbapenem group of antibiotics. This is the carbapenem group of antibiotic. This should always be given. Anyone would like to answer? Yes. Answer is imipenem. So imipenem is a drug. This is always given in combination with cilastatin. This is always given in combination with cilastatin because cilastatin is a drug. This is inhibitor of its metabolism. So this medicine is inhibitor of its metabolism in kidney. So this is inhibitor of an enzyme in kidney. We call the name of the enzyme as dehydropeptidase enzyme. So by inhibiting dehydropeptidase enzyme, this medicine can inhibit the metabolism of imipenem in kidney. So imipenem not given alone, it is given with cilastatin always, right? So question 4 answer is A. Let's talk about the other questions based on this group of medicine. Uh, you can see, okay, let me find out the other questions based on this group of medicine. Okay, okay, fine. So you can see this is based on the antibiotic combination. So what is the answer of this question, guys? Co-prescription of amoxicillin with clavulanic acid is an example of what? So all these questions have been asked in last 3 or 4 years. So you can see we are discussing the third question asked in last 3 or 4 years, how important this topic is, right? So why to skip this kind of topics? Like always read these topics in detail. So why we combine amoxicillin with clavulanic acid? What is the answer of this MCQ, guys? This is an example of what? This is an example of, anyone would like to answer? So this is an example of drug potentiation. So this is an example of drug potentiation. So whenever we combine antibiotics, you can see there are two types of effect. One is known as additive effect. One is known as supra-additive effect. So we have two types of effect. One is known as additive. One is known as supra-additive. So additive effect means when you combine two antibiotics, 1 plus 1 will become 2. This is known as the additive effect. Now, superadditive effect can be of two types. This can be 1 plus 1 will become more than 2. And this can be, okay, please make a correction. One is the additive effect. One is the synergistic effect. Please make a correction here. I have made a classification in a wrong way. So whenever we combine the antibiotic, the effect is going to be synergistic. Like whenever you combine two antibiotics, overall effect of the antibiotic will increase. Overall effect of the antibiotic will increase. So this synergistic effect can be of two types. This can be additive. This can be additive when the 1 plus 1, when you give two antibiotics together, the effect is simply add up together and the overall effect of the antibiotic treatment will increase. The second is known as the supra-additive effect. The second is known as the supra-additive effect. Now, supra-additive effect can be of two types. This can be 1 plus 1 become more than 2, and this can be 1 plus 0. This can be more than 1. So this can be 1 plus 0 become more than 1. Now, this is an example when you give one antibiotic amoxicillin along with a chemical compound which is not an antibiotic. So 0 means you have given amoxicillin with a clavulanic acid which is not an antibiotic, and the overall effect is going to be more than 1. So overall effect is going to be more than 1, and this is also known as a drug potentiation. So this has given a special name. We call it a drug potentiation. So if you ask me, sir, is this a supra-additive effect? Answer is yes, it is a supra-additive effect. If you ask me, is it a drug potentiation? Yes, it is a drug potentiation. If you ask me, is it a synergistic effect? I will say yes, it is also a synergistic effect. So all the three possible answers are there, but you have to choose the best possible, most specific answer. And the most specific answer is drug potentiation. That's why we will choose here the potentiation as a best effect, right? So I hope this is now clear. Now, can any one of you give me the example of 1 plus 1 will become more than 2? So this is an example when you give two static antibiotics. This is an example when you give two static antibiotics and the overall effect will become sidal. So when you give two static plus static and the overall effect will become sidal, this is known as the example of supra-additive effect again. So can you give me one example where two static antibiotics are combined and they will become sidal? Can you give me one example? Can you give me one example? The example is cotrimoxazole. So example is cotrimoxazole. When you give two static antibiotic and they become sidal, this is an example of supra-additive effect. Now, what is the example of additive effect? So additive effect के example में, whenever we treat any serious infection, whenever we treat any serious infection, in the treatment of serious infection, we always give two sidal antibiotics together. So whenever we treat any serious infection, we have to give two sidal antibiotics together, and the overall effect will be the additive effect. Additive effect. One example is beta-lactam antibiotics given with aminoglycoside antibiotics. So beta-lactam antibiotics given with aminoglycoside antibiotic whenever we treat any serious infection. So this is an example of additive effect. So in this way, guys, we have some examples. We have other examples also, and those examples we have covered during our regular batch lecture. So answer to this question is drug potentiation. I can see most of you have marked the answer as A, but some of you have given the answer as D also. So D is the most perfect answer, most specific answer to this MCQ. Now this question is also based on the same thing, time dependent killing. So time dependent killing is again shown by penicillin. So you can see they are targeting the beta-lactam antibiotics. So every time they are targeting the beta-lactam antibiotics. So this is a fourth question I think we are discussing that is based on beta-lactam antibiotic. So time dependent killing caused seen with beta-lactam antibiotic, gentamicin, daptomycin, rifampicin. Okay, so these two medicines follow concentration dependent killing. These two medicines follow concentration dependent killing, and rifampicin is a medicine. This follow both type of killing, concentration dependent, time dependent killing. This follow both type of killing. Rifampicin follow both type of killing. Gentamicin, daptomycin follow concentration dependent killing, and penicillin follow time dependent killing. Now, guys, can you please tell me one more question that is asked in your exam? Metronidazole follow which type of killing? Metronidazole associated with which type of killing? Is it associated with concentration dependent killing or time dependent killing? Anyone would like to answer? So metronidazole follow which type of killing? Do you think metronidazole is important for you? So metronidazole is a medicine that will cover gram-negative bacteria. This medicine mainly cover gram-negative bacteria, and also this medicine can cover anaerobic bacteria. So this is the very perfect antibiotic for the dental infection. So dental infection caused by gram-negative, gram-positive, and to some extent by the anaerobic bacteria. So metronidazole is one very good antibiotic for dental infection, and this medicine follow concentration dependent killing. So this medicine follow concentration dependent killing. So I told you this kind of aspects they can ask you in topic of antimicrobial. Okay, guys. So these are the questions which I have taken. Now you can see the question number 19 again. This is again based on beta-lactam antibiotics. So this question is again based on beta-lactam antibiotic. So this is based on cephalosporins. This question is based on cephalosporin. So can you please find out what is the best answer? This question based on cephalosporin, where the cefazolin. Cefazolin is a generation 1 cephalosporin and ceftriaxone is a generation 3 cephalosporin. So what is the most important difference? What is the most important difference between generation 1 and generation 3 cephalosporin? Anyone would like to answer? So generation 1 cephalosporin, this is again a question PYQ asked in your AIMS exam 2023 exam. So 2023 INI-CET exam, this question was asked. So can you please answer what is the difference between generation 1 cephalosporin and generation 3 cephalosporin? So generation 1 cephalosporin mainly active against gram-positive bacteria, and generation 3 cephalosporin mainly active against gram-negative and to some extent against some of the gram-positive bacteria. So here the best answer is B, Bombay. So ceftriaxone is a generation 3, right? So ceftriaxone have more activity against gram-negative and then gram-positive bacteria than cefazolin. Okay, so answer is B, Bombay here. Got it? Now, guys, you can see the choice C, anaerobic. So you must be knowing cephalosporins. Cephalosporins have two drawbacks. This cannot be useful for listeria cephalosporin cannot be given for anaerobic bacteria. That's why in your dentistry, you people must be knowing कि dental infection में anaerobic bacteria is involved. And when the anaerobic bacteria is involved, cephalosporin is not a good option for a dental surgeon. So whenever you people sit in your OPD, you people don't prefer to give cephalosporin to the patient, but you people prefer to give penicillins. So penicillins are useful against anaerobic bacteria. Cephalosporins are not useful. That's why cephalosporin is not a good option being as a dental surgeon, but penicillin is a very good option. So in beta-lactam antibiotics, if we talk about the beta-lactam antibiotics, so penicillins are useful and even the carbapenims. Carbapenims are useful for anaerobic bacteria. Penicillins are useful, carbapenims are useful, metronidazole is useful for anaerobic bacteria. So these are the three main group of antibiotics which we can use against anaerobic bacteria. One more antibiotic which is nowadays now outdated, the drug name is clindamycin. So in whole medical science, like if you ask me, sir, कौन से एंटीबायोटिक डेंटिस्ट्री में बेस्ट होंगे तो आंसर इज दीज आर द एंटीबायोटिक्स विच आर यूजफुल अगेंस्ट एनरोबिक बैक्टीरिया और डेंटिस्ट्री में गाइस वी पीपल हैव टू कवर एनरोबिक बैक्टीरिया so penicillin group of antibiotics these are the broad spectrum antibiotics so some of the penicillins are broad spectrum like amoxicillin so amoxicillin will cover gram positive gram negative anaerobic bacteria so you always prefer to use these kind of antibiotics in your dentistry so option C is completely false statement. Right, guys? So in this way, guys, they can ask you the question. And anything else you want to ask? Dr. Sud is asked a question. It is always advised to use metronidazole in combination with beta-lactam antibiotics. Yes, doctor. Because metronidazole will not cover the gram-positive bacteria. So beta-lactams may we have beta-lactams will cover gram-positive bacteria and gram-negative bacteria as well. So the spectrum is important. Like if you ask me amoxicillin will cover gram positive, gram negative, and as well as cover anaerobic bacteria. So this is a perfect medicine for your dentistry. And you know that amoxicillin is not given alone, it is given with clavulanic acid. You can see the next question. This is again asked in your dentistry exam. Amoxiclav, what is the dose, guys? Amoxiclav का usual dose is 625 milligram twice daily. Sorry. Yes, 625 milligram twice daily or thrice daily. That depends on the patient weight and also depends upon the severity of the infection. So where the infection is less, you can give twice daily. Or if the patient is lean, you can give twice daily. Patient is obese, patient is overweight, patient infection is serious, you can give thrice daily. But if the patient is infection is getting more serious, so patient infection is more serious, instead of giving 625 milligram, you can give 1000 milligram. You can give 1000 milligram two times in a day. So 1000 milligram two times in a day. So if you are giving 625 TDS, your total dose giving how much? So this is 500 plus 125 combination. So if you're giving thrice daily, you're giving 1500 milligram plus 375 milligram. But here, what do you do? 1000 milligram BD mein, what is the dose? This is the dose. Yes, you will give. Yes, now here, how much dose you will give? You will give 1750 milligram. 1750 milligram and the 250 milligram of the clavulanic acid. You can see you have increased the dose further when the infection is getting more serious. That's why being as a dental surgeon, you should be knowing, right? Yes, so all these things are important for you. Yes, any doubt you people have? Okay, the chat is missed. Yes. Serious infection like, okay, so for you people, the serious infection like the serious periodontitis. Patient has got serious periodontitis. So guys, I am not a dental surgeon, so I remember only few infection that is serious. So जैसे jaw का infection हो गया, there the bone is involved. So if your bone is involved, or if the patient has got a serious periodontitis, then you can give the medicine dose 1000 milligram BD. right? And can you please tell me what is a, like in children, the dose of the medicine is 325 milligram. So in children, the dose is 325 milligram. So what is the configuration in 325 milligram? What is the configuration in 325 milligram? Anyone would like to answer? Yes, yes, osteomyelitis. Can you please tell me what is the configuration in 325 milligram that is useful for children? Yes, it is 200 milligram and 125. So you can see this is 125 always. This is how you will identify. So whether the concentration is 500, 325 or it's 1000 milligram, this is going to be 125 always, because 125 say upper we cannot keep. So it's always 125. So this is how they can trap you in amoxiclav, right? And other questions which we can think of, I think these are the 4 or 5 questions that we have taken from beta-lactam antibiotic. So you have observed that in last 5 or 6 years, so many questions have been asked from beta-lactam antibiotic. So this topic is very important for your exam. So in case you people have other doubts, please ask. Now let's move on to the next question. Now this question is based on painkiller. So whenever we talk about pain, so guys, you should be discuss this. You should be knowing the topic in 4 headings. So pain can be due to inflammation. So patient can have the inflammatory pain, where the NSAIDs you should be knowing in detail, because being as a dental surgeon, you people can come across with the pain due to the inflammation. Patient can have pain due to the inner structures, inner viscera which are involved. So inner viscera, like the bone is involved. So the pain will come from the inner organs or the inner part of the body. Then here we have to give the opioids. So opioids are the more efficacious painkiller. So they have the more efficacy than NSAID. So these medicines are given as a painkiller, but they have no anti-inflammatory property. They can only treat the pain, but they have no anti-inflammatory property. But they are more efficacious painkiller, more efficacious than NSAID in relieving the pain, but they cannot treat the inflammation. The third type of pain is neuropathic pain. So patient can have the pain due to neuropathic. So here, as a dentist, you should be knowing about the trigeminal neuralgia. So you should be knowing about the best treatment for trigeminal neuralgia. So trigeminal neuralgia, you should be knowing. You should also be knowing the diabetic neuropathy. You should also be knowing the herpes neuropathy, diabetic neuropathy, trigeminal neuralgia. So all these things are important. Spinal cord injury neuralgia, all these kind of neuralgia treatment you should be knowing. The fourth one is the patient can have the fibromyalgia. So patient can have the fibromyalgia. So which medicines we can use for all these conditions? So fibromyalgia is due to the mood swings. So patient can have the pain in body due to the mood swings, or we also call it a emotional pain. So these are the 4 categories of pain anyone can have. So you should be knowing the drug of choice for all these conditions, and also you should be knowing the medicines in detail. You should be knowing the details of all these medicines. So here the best answer is COX-2 inhibitor. For parenteral administration is parecoxib. So parecoxib start with pere word. So it is given by the parenteral route. It is given by the parenteral route. So in this way, you should be knowing the important topics. The painkillers are important for the exam. So question number 2, we have taken from anesthetics. So anesthetics you should be knowing in detail. Which anesthetics are better, which anesthetic is not better. You should be knowing about these things, right? Now this question we have taken from SSRI. So this is the SSRIs. So SSRIs are the best medicine as a mood stabilizers, right? SSRIs are the drug of choice for fibromyalgia. So fibromyalgia is a condition where the patient can have the pain because of some emotional reason, because of some mood swings, right? So this question is based on side effects of SSRI. This question is based on side effects of SSRIs. They are the best medicines for fibromyalgia, best medicine for depression, best medicine for anxiety disorder. So whenever the patient confidence level is low, patient is not feeling good, patient का mood आपने cheer up करना है, patient is having the pain due to the emotional reasons, then SSRIs will be the best medicines to be started, right? So now who will tell me what is the best answer here? So there is a one side effect of medicine, that is serotonin syndrome. So serotonin syndrome is a side effect of SSRIs and the same side effect caused by linezolid. So both SSRIs and linezolid can cause serotonin syndrome as a side effect. So serotonin syndrome की वजह से we never combine SSRIs with linezolid. And one more medicine that will cause this side effect is pethidine. So next time, maybe like this question was asked last year, maybe this year they will ask the same question in respect of pethidine. So pethidine will be asked, maybe asked in this year exam, serotonin syndrome. So here the best is hypertension, right? So SSRIs में, serotonin syndrome में, hypertension, it's an acute side effect basically. This is an acute side effect where the hypertension, sudden increase in BP will be very common. So hypertension will be very common, right? तो hypertension तो नहीं होगा, and glucose level जो होता है that is changed after some time. Like it's not like that it's a sudden effect. Sudden effect नहीं होगा इसमें. Patient will never have the sudden effect. Patient will have the immediate effect as a hypertension. Hyperglycemia is a long-term side effect. Like this will be occurring after 1 or 2 days, right? It is not immediate side effect. So better answer is hypertension. The answer is C, right? So this is the based on SSRIs. This is an important topic for the exam, right? Now you can see any other question which you want to do. Now this question is based on NSAIDs. You can see this question is based on NSAID, and this question also based on a very important topic like hypertension. So being as a dental surgeon, guys, hypertension is a topic that you should not leave. ठीक है, तो कार्डियोवास्कुलर सिस्टम में दे आस्क ओनली द ट्रीटमेंट ऑफ हाइपरटेंशन फ्रॉम यू. एंटी हाइपरटेंसिव वेरी वेरी इंपॉर्टेंट बिकॉज एज अ डेंटल सर्जन if the patient blood pressure is high, you cannot take the patient for surgery. So hypertension is very important. Second important topic is this one, anticoagulants. So second topic is anticoagulants and antiplatelets. So whenever you people perform surgery, so anticoagulants and antiplatelet status you should be knowing about the patient. So anticoagulants, antiplatelets, antihypertensive drugs. So these topics are very very important for your examination point of view. Right, guys? So you can see they have asked the questions based on NSAIDs. So they have asked the drug interaction. What is the best answer here? Which of the following drug interaction is seen? Can you please give me the answer? This was asked last year. This was a question of the last year. So whenever you give NSAIDs along with anticoagulants, you are saying answer is B. No, answer is not B, guys. NSAIDs have antiplatelet property. NSAIDs have antiplatelet property. Anticoagulants will also result in more risk of bleeding. So because of the antiplatelet property, the risk of bleeding will increase. Risk of bleeding will increase, not the decreased risk, rather the risk of bleeding will increase. NSAIDs are antiplatelets, they increase the risk of bleeding, and anticoagulants will also increase the risk of bleeding. Anyone else, anything else you want to say? Based on the side effects of NSAIDs. Any idea what is the impact of NSAIDs on the blood pressure? बीपी पे क्या इफेक्ट आता है? व्हाट इज द इफेक्ट ऑफ एनिसिड्स? एनिसिड्स क्या करते हैं ब्लड प्रेशर को? whenever you take painkillers, what is the side effect? Yes, doctor. Anisids, aspirin is an antiplatelet. Aspirin is used as an antiplatelet. And Dr. Garima, non-selective COX inhibitor, all are antiplatelets. All non-selective COX inhibitor have antiplatelet property. Can you please tell me, guys, what is the impact of NSAIDs on hypertension? Can you please tell me about this? So answer is NSAIDs can cause water retention. NSAIDs can cause water retention, can cause sodium retention. And because NSAIDs can cause sodium and water retention, they can counter the effect of diuretics. So diuretics का effect जो है that is going to be reduced, right? So diuretics will show the reduced diuresis, and as a result of that, the patient blood pressure will increase. So antihypertensive drug का efficacy will decline. Antihypertensive drug ka efficacy will decline. It is not going to increase, but the diuretic effect is going to be decreased. So answer is A here. So BP will increase and diuretic effect is going to be decreased. And because they will cause water retention, they can cause congestion in the body. Anesthetics can cause congestion, more water, more load to the heart. So heart failure patient ka mortality will increase. So they will increase the mortality. They increase the mortality in heart failure. So they are contraindicated. So anesthetics are contraindicated in patients of heart failure. So this question was asked last year in your exam. Answer is A. So in this way, they can ask questions on painkillers. So painkillers mein questions are asked from you people, right? So questions can be asked on the painkillers, like this question. One more question based on painkiller. A patient has got diabetic neuropathy, and there is one more neuropathy given the exam. I think they have given you the spinal cord injury neuropathy and post-herpetic neuralgia. So when this question was asked to you in exam, they gave you post-herpetic neuralgia. पेशेंट को हर्पीज का पेन है, डायबिटीज का पेन है, स्पाइनल कॉर्ड इंजरी का पेन है. So which medicine will you prefer to give? So which medicine we can give? So this was the clinical trial which was done recently, and studies have found that pregabalin. So pregabalin is a medicine that is found to be effective in the treatment. So all the three neuropathy, pregabalin is useful. And you, as a aspirant of the AIMS exam, you should be knowing the drug of choice for all these three disorders. So all the three disorders, the drug of choice is important for you. Although pregabalin is used everywhere, but it's not a drug of choice, right? It is a drug of choice only for this condition, but not for the other condition. Like for the post-herpetic neuralgia, drug of choice, tricyclic antidepressants. For diabetic neuropathy, duloxetine. Duloxetine, which is an antidepressant, SNRI, is a drug of choice. So here in this MCQ, you should be knowing the treatment of choice for all type of neuralgia. This topic is important as a painkiller. You can see many questions have been asked from painkillers. So question 15, like this time in your exam, they have asked you the trigeminal neuralgia. So who will tell me trigeminal neuralgia? Carbamazepine is a drug of choice. Who will tell me what are the other medicines that we can use? Trigeminal neuralgia asked this time in your NEET exam. So this time in your NEET exam, they asked you the carbamazepine. They already gave you that carbamazepine is a drug of choice. But what is the second drug of choice for this condition? What are the other medicines that we can use for trigeminal neuralgia? Asked this time in your NEET exam. So every time they ask one painkiller. One question based on painkiller is important for you. This is a very important topic. So carbamazepine is a drug of choice. Gabapentin will be the second, lamotrigine and the baclofen. So lamotrigine and the baclofen will be the third and fourth that we can use. Yes, so pregabalin, gabapentin will be the second. Gabapentin, pregabalin will be the second. The third will be the lamotrigine and the baclofen. So in this time, they have given you all these options. So in this way, guys, you people have to find out the best possible answer out of all. Okay. So, okay. So this was again a question based on a painkiller. So morphine is a painkiller belong to opioid class. So what is the answer, guys? So morphine can cause some actions that we can remember with a mnemonic PM cares. So mnemonic is PM cares, where the P stands for physical dependence. P stands for physical dependence. M stands for meiosis. M stands for meiosis. M stands for muscle rigidity. C stands for constipation by reducing the peristalsis. This will lead to analgesic effect. This will lead to respiratory depression. This can result in euphoria also, and this can result in sedation and drowsiness also. So sedation, drowsiness, euphoria, respiratory suppression, analgesic effect, constipation, meiosis, all these things can be seen. Now, morphine is a medicine that can also release histamine. And because this can release histamine, this will cause bronchospasm. It's a side effect of the medicine. It will cause bronchospasm and it can also cause the vasodilation because of releasing a histamine. So here in this MCQ, what is the answer? So this is again a painkiller. Morphine can cause bronchoconstriction. It's an analgesic drug. Can cause meiosis. Right? So this medicine will not cause tachycardia. Answer is BCD. So answer is BCD. So BCD, all three options are correct. What is the impact of morphine on the heart rate? So morphine can inhibit the vasomotor center. So morphine can inhibit the vasomotor center, can reduce the BP, can reduce the heart rate. So this morphine can cause bradycardia. Instead of causing tachycardia, it will cause bradycardia. Dr. Kriti has asked a question between oxcarbazepine and carbamazepine, which is better? So Dr. Carbamazepine is better. Dr. Krati, carbamazepine is a better answer that you will mark. Okay. So in this way, guys, they can ask you the questions based on uh, various painkillers. So painkiller wala topic we people have discussed. In case you have any doubt in painkiller, please ask. If you have any doubt in painkiller, please ask. Now the third topic, which is very important, which every doctor, not every doctor, even the every citizen should be knowing, the treatment of acute emergencies. So treatment of life-threatening emergencies, very, very important. So treatment of all life-threatening emergencies, everybody should be knowing. You should be knowing how to treat the shock. You should be knowing how to treat the allergy. You should be knowing how to treat a patient of acute hypotension or high BP. So acute hypotension, how to treat allergy, how to treat the patient of shock, right? You should be knowing how to treat a patient of cardiac arrest. You should be knowing how to treat a patient of tachycardia, how to treat a patient of bradycardia, right? So all these life-threatening emergencies are important. So whenever we are posted in emergency department, these are the cases which we usually come across. तो हमें शॉक का पेशेंट दिखता है इमरजेंसी में, हम कैसे मैनेज करेंगे शॉक का पेशेंट? एलर्जी का पेशेंट आता है, हाउ टू मैनेज एलर्जी का पेशेंट? सिवियर फॉल इन बीपी, पेशेंट का ब्लड प्रेशर सडनली फॉल कर गया, हाउ डू यू मैनेज? पेशेंट का बीपी सडनली बढ़ गया, हाउ डू यू मैनेज? हाउ डू यू मैनेज द कार्डियक अरेस्ट? हाउ डू यू मैनेज द टेकिकार्डिया, ब्रेडिकार्डिया? How do you manage the acute epilepsy? So how do you manage the acute epilepsy? How do you manage the acute diabetic ketoacidosis? So all these things are acute emergencies that should be knowing. So acute epilepsy को कैसे मैनेज करेंगे? Diabetic ketoacidosis को how will you manage? So all these things you should be knowing, right? So life threatening emergencies में these are the emergencies that everybody should be knowing. The best treatment, the best answer should be knowing. So question number 3 is based on that. Anaphylaxis. So what is the drug of choice for anaphylaxis? The drug of choice for anaphylaxis is adrenaline or the epinephrine. And this adrenaline will act on alpha 1 receptor and increase the blood pressure. By acting on beta 2 receptor, this will cause bronchodilation and can save the life of the patient, where the patient will have the low BP. So anaphylaxis mein patient will have the low BP, patient can have the bronchospasm. So this medicine will take care of both. So this is the drug of choice preferred over norepinephrine. Now, what is the route of administration? Yes, the concentration of medicine is 1:1000. So medicine concentration 1:1000. The route, the dose of the medicine is zero point 0.5 milligram. 0.5 milligram is the dose, and the route of administration is IM route. So the best route is IM route. This is how we give the medicine to a patient. This is for the adult patient. ये adult patient का dose है. Pediatric patient का dose is 0.3 milligram. 0.3 milligram is a dose for the pediatric patients. Now this medicine can be given by other routes also. So this medicine can be given by subcutaneous route, IV route, and the medicine can be given in the form of nasal spray also. So these are the other alternative routes, but इनमें से better क्या है? This is not been defined. There is no comparative study available. Like I cannot say कि subcutaneous is better or IV is better. That depends on the patient clinical scenario. We can use this, right? Like if your patient is stable, you can use the subcutaneous route. If the patient is highly unstable, you can use the IV route. Or if the patient is at home, patient wants to take medicine by himself. Patient is at home, patient wants to take medicine by himself, we can use the nasal spray. And out of these, the nasal spray is the latest form. Nasal spray is the latest form of the medicine, and this can be asked in exam. You should be knowing what is the dose through the nasal spray. So nasal spray से कितना dose है epinephrine का? It's a new technique by which we can give epinephrine to the patient for anaphylaxis. You should be knowing the dose of the medicine through the nasal spray. All these things are important for this year AIMS exam. So subcutaneous route is preferred over IV route? No, we don't have any study available. Intravenous route is preferred over intramuscular? No, intramuscular is most preferred out of all. And phenylephrine is preferred over epinephrine? No. So answer is A, epinephrine. That is the other name of adrenaline. This is the best medicine for the treatment. And you should also be knowing the treatment of choice for all other acute emergencies which are important for the exam. Now, apart from all these acute emergencies, there is one more emergency that you people come across when you are posted in emergency department. That is your poisoning. ठीक है, एक तो हमें ऊपर वाला इमरजेंसी मिलता है, दूसरा हमें जो केसेस मिलते हैं वो मिलते हैं पॉइजनिंग के. सो ट्रीटमेंट ऑफ पॉइजनिंग एंड देयर एंटीडोट्स. So treatment of poisoning, especially the antidotes have been asked. So this topic is also very important because these are the cases which we actually come across. So being as a dental surgeon, like I still remember when I was intern in my hospital. So at that time there were some dentists who were posted along with me. So even they were also assisting us, like they were helping us in treating all these patients. So at that time they were remembering all the regimens that were useful for poisoning patients. So even as a dental surgeon, although these cases are not yours, but still, as a doctor, as a human being, you should be knowing how to manage the cases of poisoning. So here, what is the answer? Naloxone is used in the following condition except. So in which condition this medicine is not used? Answer is it is not given for benzodiazepine poisoning. So this medicine cannot be given for benzodiazepine poisoning. Although the question is not very relevant, I think there is a problem in the feedback. So ideally, it should be where this medicine is used. Because when this question was asked, I still remember I have taken the feedback from the student and they told me, sir, they asked you, okay, where do we use naloxone? So the best answer was it's an antidote of choice for opioid poisoning. It is an antidote of choice for opioid poisoning, right? So benzodiazepine poisoning mein guys, who will tell me the antidote? The antidote of choice is flumazenil. So this is one more important topic that you should be knowing because as a doctor, you should be knowing how to tackle with the poisoning, right guys? Now you can see adrenaline जो है one drug that is very important for your exam is adrenaline. So there are many questions that has been asked on this medicine that is adrenaline. You should be knowing all the indications, everything about this medicine that is adrenaline. Very, very important drug for your exam. So adrenaline is an important drug. And what is the answer of question number 6? What is the answer of question number 6? Adrenaline is not indicated for which condition? Anyone can answer? So cardiopulmonary resuscitation, that's a cardiac arrest. So in patients of cardiac arrest, this adrenaline is a drug of choice. This is also used as a vasopressor. It's also used as a vasopressor. It's a second drug of choice for acute hypotension. It is a second drug of choice for acute hypotension. This medicine is drug of choice for anaphylaxis. So it is not given as an antiarrhythmic. So torsades de pointis is the name of the arrhythmia. It is the name of the arrhythmia. So adrenaline is a drug. The medicine side effect is tachycardia and arrhythmia. So this medicine can stimulate the heart, can cause tachycardia and arrhythmia. So this medicine will not be given for the treatment of arrhythmia. So arrhythmia ko this medicine will further increase. So this is not useful for that condition. So question number 6, adrenaline ke indications are important for your exam. This drug is overall very important for your exam because all its aspect can be asked. One more aspect of this medicine is like we can discuss. We can use this medicine along with anesthesia drug. We can use this medicine along with the anesthesia drug, right? So which of these is most commonly used in dental anesthesia? You should be knowing all the concentration. You should be knowing the duration of action. So duration of action, all the concentration that we use in dental anesthesia. What are the side effects when we use this medicine? What are the advantage? What are the disadvantage? Each and every aspect of epinephrine. Each and every aspect of this epinephrine is important for your exam, right? So what is the answer here? Yes, we can use the medicine concentration. Most commonly is 1 is to 80,000. Yes, this is correct. Most commonly is 1 is to 80,000. But here, which answer will you mark? The point is which answer you will mark. Dr. Kriti, torsades de pointis is one type of arrhythmia. It's a ventricle type of arrhythmia. It's a ventricle type of arrhythmia, right? So that is used, right? So here the best answer will be the 2% because there's no other option to mark. So 2% will be the best answer that we can mark over here, right? Okay. But they have given us 1 is to 1000. I think there's a problem in the question. Wait, guys. इसमें हम ये mark करेंगे फिर. There's no. Yes, there's no other option. Like we cannot use 1 is to 1000 of this adrenaline. We have to use minimum 1 is to 80,000. So this will be the answer. So 2% will be the answer, right? without epinephrine. So this is based on the local anesthetic drugs also. So one more topic which is important is local anesthesia drugs. So local anesthetics along with adrenaline, that is asked. Yes, Dr. Adhira, I will share all this, whatever are your doubt. Like I'm just telling you the topics right now. Because of lack of time, I cannot discuss everything. So in case any topic you find, ki sir, you have mentioned this topic is important, but we are not having the related content of this topic. So I'll share all those things with you. Just message me whatever you want me to discuss, right? Right. So we use this medicine concentration 1 is to 80,000, but mostly in lakhs also. That's why the option A and B are false right here. And similarly, like one more question based on local anesthetic drug. So local anesthetic is again an important topic, right? So most cardiotoxic local anesthetic is bupivacaine. That's why nowadays we are using levobupivacaine. So we are using levobupivacaine instead of the bupivacaine. So this is not cardiotoxic. We are using this medicine levobupivacaine, right? Yes, Anjali Gupta, we have rectified the question. Answer is D only. A 13th answer is bupivacaine. So local anesthetic is an important topic. Local anesthetic is an important topic. Okay, Dr. Sudha is a G student. Okay, so doctor, this is a medical class. So JE के students को okay, this will be helpful, Sudha. Like you can learn CPR from here as a JE student. CPR at least everybody should be knowing, right? Okay, guys, there is one more question based on cholinergic poisoning. So one more question based on poisoning. Patient has taken some mushroom. So mushroom is colorful mushroom, right? So muscarinic drug. So it's a muscarinic poisoning. Mushroom is colorful mushroom. Muscarinic is a word that we use. So now we have to use the anti-muscarinic agent. So they're asking which is not going with the mushroom poisoning. So mushroom poisoning, dumbbells is a mnemonic that will lead to cholinergic effect. So this will lead to cholinergic effect. So in cholinergic effect, you can see we can have the meiosis. So all this based on poisoning. So I told you poisoning, how to tackle a poisoning, every doctor should be knowing. So even the students who are not doctors, they should also be knowing how to tackle this poisoning on day-to-day basis. Okay, guys. And one more topic which is important is general anesthesia. Sorry, not general pharma mein. So general pharma mein, guys, what they ask you, the most important topic is DRC. So every time they will give you one graph and you have to mark the answer on the DRC. Most of the time they ask you the drug efficacy, they ask you the drug potency, or maximum they will ask you the LD50 and ED50 ratio, that is known as the therapeutic index. So DRC is the important topic. This is what they can ask you. Second topic they can ask you about the drug absorption. So drug absorption and the bioavailability is a second topic they can ask you, right? Number three topic, they can give you one numerical, or numerical में they can ask you the volume of distribution and the half-life. So yes, the students who are from JEE students can solve this numerical also. So volume of distribution and the half-life numerical they can ask. These are the three important. Okay, one more topic which is important is receptors. They can ask you the type of receptors. They can ask you the type of receptor on the cells. So numericals are important, types of receptor on the cells are important, absorption topic is important, and DRC topic is important. So let's discuss this question fast because of lack of time. Just discuss the answer. So drug absorption is best measured by area under the curve. So drug absorption is best measured by area under the curve, which is also known as bioavailability. So drug absorption is also known as bioavailability, right? Dr. Krati, there is no word like availability. So pharmacology mein there is no word like availability. So we have bioavailability, we have bioavailability, right? That is best calculated by area under the curve. So that is best calculated by area under the curve. Yes, Dr. Adhira has asked one question. So why not the answer is bioavailability? Doctor, there is no specific reason for that because Area under the curve is a graphical parameter that we actually use. We actually calculate, the actual calculations are done with the graph, and we calculate this graphical parameter. We call it area under the curve. Now we give a arbitrary name to this. Like we have assumed that name given to this graphical parameter is bioavailability, right? So there is no specific reason. If you ask me why the bioavailability is a better answer, although both like area under the curve is known as the bioavailability, so both will be the correct answer, but graphical parameter is actually the calculation. So area under the curve is a better answer according to me. There is no specific reason for that, right? Maybe the feedback is wrong in this MCQ which we have got from the student. So there is no specific reason for that. Sorry for that, Dr. Dhira. Right? One more question based on like this question. Can you solve this question, guys? The elimination rate constant is given as 0.05. So elimination rate constant is given as 0.05 per hour, and they ask the half-life. So the half-life of the medicine is 0.693 divided by K, and they have given the value of K as 0.05. So what is the answer? You have to calculate. The answer is going to be 13.9. So these kind of calculations they can ask you. So this formula can be rewritten as like this way: volume of distribution upon clearance. This can be written like this way: volume of distribution upon clearance. This is the same thing because the K is equal to clearance upon volume of distribution. The K is equal to clearance upon volume of distribution. So we can replace the values. So answer is going to be 13.9. So answer is going to be C. This is the type of numericals they can ask you. Okay. And there is one more question which I have picked from the general pharma for you people. So general pharma mein, what was the question, guys? This was the question. Yes. So this was the question. Can you please tell me which option is correct? Which option is correct here? So they have shown you the effect of three medicines. They've shown you the effect of three medicines. They've shown you the effect of three medicines, and now you have to choose the best answer. So drug A has maximum potency but the least efficacy. B and C are competitive inhibitors. B is more potent but equally efficacious as C. C is more potent than B. So which options are correct? This is the option A, B, C, and D. Select the correct answer. So which options are correct, guys? Anyone would like to answer? So the correct answer will be the A and C. So A and C will be the correct answer. So in case you people have any doubt in this MCQ, please ask. So A and C will be the correct answer. So A and C will be the correct answer. A is on the left side, and because the A is on the left side, it has the maximum potency, but the height is minimum, so it has the least efficacy. It has the least efficacy. And if you see the C option, B and C are almost equally efficacious. B and C are almost equally efficacious, but B is more potent than C. So here the best answer is A and C. So A and C will be the best answer. Anjali, B and C cannot be कॉम्पिटिटिव इनहिबिटर देखो कॉम्पिटिटिव इनहिबिटर के लिए द मेडिसिन शुड बी सेम वी हैव डिस्कस ड्यूरिंग आवर लेक्चर आल्सो कि व्हेनेवर वी रीड दिस काइंड ऑफ ग्राफ यू फर्स्ट ऑफ ऑल सी कि जो ग्राफ है दिस इज शोइंग द इफेक्ट ऑफ थ्री डिफरेंट मेडिसिन और द सेम मेडिसिन लाइक इफ आई ड्रॉ द ग्राफ लाइक दिस वे if I draw the graph like this way, this is the competitive blocker. This is showing the competitive block. When the drug remains same, this is the competitive block. So here the drug is changing. So we cannot say कि C is a competitive blocker of B. We cannot say like this way. So when the drug A graph is changed, then we will say कि right now in body we have a competitive blocker. That's why the graph is shifted towards the right side. So they can ask you this kind of questions from the DRC. So DRC is an important topic. I told you this is a dose response curve topic they have asked. Right, guys? Now this question is from antibiotic side effect. So this I told you already. So side effect of antibiotics important. I told you. साइड इफेक्ट्स ऑफ एंटीबायोटिक्स. female pregnant female है, UTI है फीमेल को, Now, you have given some antibiotic, although we never give tetracyclines for UTI. UTI में tetracyclines को नहीं देते. Question को frame किया गया है just to find out the best answer. So what is the answer? So tetracycline, oxytetracyclines will be the best possible answer. So A is the best answer. Ciprofloxacin will cause tendon and cartilage problem. Ciprofloxacin will cause tendon and cartilage problem, but tetracycline, oxytetracycline will cause problem of the malformity. So this is the teratogenesis. So this side effect is based on teratogenesis. So side effects of antibiotics they ask you because you people have to deal with all these MCQs, right? Now, next question is this one, like liver enzyme inducers, liver enzyme inhibitor. So guys, one question will be based on drug interaction. Every year in your exam, one question is based on drug interactions. So drug interactions, what will happen if you give antibiotics together, not antibiotics, if you give multiple drugs together, what will happen? Answer is drug interaction will occur. And in drug interaction, you should be knowing the medicines which are liver enzyme inducers, the medicines which are liver enzyme inhibitor. This is very important. So in this MCQ, they are asking the patient is taking oral contraceptive pill. Now, which drug is given so that the patient will have the failure of the treatment? So here the answer is rifampicin. Rifampicin is a liver enzyme inducer. Rifampicin is a liver enzyme inducer. Phenytoin, phenol, okay, these medicines are liver enzyme inducers. And because these medicines are liver enzyme inducer, they can induce the metabolism of OCPs. But sodium valproate is a liver enzyme inhibitor. Sodium valproate is a liver enzyme inhibitor. All other medicines are liver enzyme inducer. So here the answer is B, C, D. So B, C, D are correct. So all the three medicines are liver enzyme inducer. You should be knowing the list of liver enzyme inducer and inhibitor here. ठीक है, इस MCQ में you should be remembering the list of liver enzyme inducer and inhibitor. Let's move on to the next question. This question is based on, yes, specific indications. So this is very important. Specific indications of antibiotics. Specific indications of antibiotics. Antibiotic prophylaxis. This is very, very important. So antibiotics mein, I'm just highlighting one more topic. Antibiotic that is given for a prophylactic purpose and antibiotics which are given for specific indications. Dr. Sud has asked one question. Yes, microsomal enzyme inducer. Yes, Dr. Sud, the medicines, देखो हमारे लिवर में we have two types of enzymes, microsomal, non-microsomal. तो non-microsomal के साथ interaction नहीं होते. We have the drug interaction with only microsomal enzymes. So the medicines which are we say कि liver enzyme inducer or inhibitors हैं, they are always in context with microsomal enzymes. ठीक है, तो you can take it in both ways. So microsomal enzyme is same as the liver enzyme inducers and inhibitors that we discussed above. So antibiotic prophylaxis, specific indications of antibiotic, very important. And you should be knowing the dental surgery prophylaxis in detail. So dental surgery prophylaxis in detail you should be knowing. And also you should be knowing which drug we give if the patient is penicillin allergic. If the patient is penicillin allergic, how to tackle this patient? So how to tackle this patient if the patient is penicillin allergy? So यहाँ पर question क्या है? Patient is undergoing the extraction of the first molar due to periodontal disease. Most appropriate antibiotic of choice in this patient. So answer is amoxiclav. Amoxiclav आप देंगे इस patient को, yes. Amoxiclav आप देंगे. डॉक्टर भाटी हैज आस्क्ड कि सेंट्रल नर्वस सिस्टम में कौन से इंपॉर्टेंट टॉपिक है. तो डॉक्टर भाटी, आई टोल्ड यू ओपियोइड्स. ओपियोइड्स आर द पेन किलर विच इज वेरी इंपॉर्टेंट फॉर यू. एवरी ईयर, हर साल ये क्वेश्चन आएगा. एवरी ईयर यू गेट वन एमसीक्यू ऑन ओपियोइड. विदाउट फेल यू विल गेट वन एमसीक्यू ऑन ओपियोइड्स. एंड यू शुड बी नोइंग लिटिल बिट अबाउट एंटी एपिलेप्टिक ड्रग्स. एंटी एपिलेप्टिक ड्रग्स, एंटी डिप्रेसेंट्स में एसएसआरआईज, एंटी साइकोटिक में क्लोजापिन. So antipsychotic में clozapine, SSRIs and general anesthesia drugs and the pre-anesthetic drugs. So these are the important topics. So opioids very important. General anesthesia will be covered by some other faculty in other subjects, right? And pre-anesthetic drugs. Clozapine is an antipsychotic. SSRIs is an antidepressant. Anti-epileptic drugs is one more topic. So these things can be asked. ठीक है. Why not ornidazole? Guys, ornidazole जो drug है, this is mainly for gram negative bacteria. This is mainly for gram negative or anaerobic bacteria. This belongs to metronidazole class. This belongs to metronidazole class, and you must be knowing periodontal disease may even the gram positive bacteria is also there. So gram positive bacteria is there, and amoxicillin is a medicine that will cover positive, negative, and anaerobic all. This is a broad spectrum medicine that we can mark as the best answer. So amoxicillin is a better answer than onidazole here. Okay, this is the reason. Dr. Preeti has asked what is LD50 and ED50. LD50 is lethal dose. Dr. Preeti, lethal dose 50, effective dose 50 का रेशियो को बोलते हैं therapeutic index. Therapeutic index we call, right? Okay, one more student is asking about the GIT. So GIT में guys proton pump inhibitor मत पढ़ के जाना. It's not important topic. हंसिका, GIT में please read anti-emetics. GIT में please read antiemetics. This is a very very important topic, particularly the metoclopramide. This is asked this time in NEET PG also. Every year they ask question on metoclopramide, domperidone, antiemetics, chemotherapy induced vomiting. Chemotherapy induced vomiting is very important topic, like ondansetron, aprepitant. जो new drug है ये aprepitant. This is very very important for your exam. So antiemetics are important, and the GERD is a second topic. So these two topics are important. Antiemetics and GRD are two important topics. Now, question number 22 is based on potency of the inhalational general anesthetic. You must be knowing कि nitric oxide जो है, it's an incomplete anesthetic drug. It's an incomplete GA drug. It is a very good painkiller, but it's not a good anesthesia drug. So, whenever they ask for potency, nitric oxide is always the last. Methoxyflurane is outdated, nobody used because of nephrotoxicity, but it is a very very efficacious medicine. So this is going to be the correct option. Nitrous oxide ko you keep always in last, and other medicines ko you can easily find out the answer if you know this point कि nitrous oxide is an incomplete anesthetic agent. Okay, so this was the question based on your problem of oral candidiasis. So there is a topic bronchial asthma. So respiratory system में guys bronchial asthma के drugs पढ़ लेना. So bronchial asthma के drugs are very very important for your exam. So they have shown you this delivery methods, right? कौन कौन सा drug इस route से cannot be given? So anyone can answer. Yes, Montelukast. Montelukast cannot be given by this route. Montelukast cannot be given by this route. But we have to choose two answers. So I think you will mark C and D. Although sodium chromoglycate, when it was there in the market, this was available as an inhalational agent. But nowadays, this is outdated. So this was available as inhalational agent when it was there in the market. But nowadays, sodium chromoglycate is gone. So sodium chromoglycate gone hai. These are the main drugs that we are using these days. Budesonide is a drug of choice. Budesonide is a drug of choice for bronchial asthma. So C and D will be the best answer, right? So bronchial asthma is topic important in respiratory system. Now this is the topic from diuretics. So diuretics में guys एक नया group है medicine का SGLT2 inhibitor. So this topic is very important. Diuretics में the medicines that will act on PCT of kidney. So medicines that will act on PCT of kidney like SGLT2 inhibitors, carbonic anhydrase enzyme inhibitor, and the medicines like mannitol. So these are the three group of medicines which are very important in diuretic topic. So diuretics mein these three drugs are important, and there is a topic endocrine. So endocrine mein there are three topics which are important. One is diabetes, one is thyroid, and one is osteoporosis. So osteoporosis को रहने दो. Diabetes, thyroid, and steroids. Steroids के side effects. Side effects of steroids, diabetes mellitus, thyroid topic is important in endocrine. So in this MCQ, they ask the best medicine for liver cirrhosis with ascites. So best answer is eplerenone. So diuretics में एक और topic है potassium sparing diuretics. Potassium sparing diuretics like spironolactone that you can read. I think this is all about for this. We have tried to cover most of the topics which are relevant for your AIMS exam. I've given you some directions कि ये topics important है. And in case you find that any of the topic you people are not comfortable with, you can just highlight to me. What we can do, I can request the management team, we can keep a special session for those topics in which you are not comfortable, right? So we can discuss those topics only. Okay, again, don't send the list of 10 or 20 topics, because maximum I can do, I can request that management team to arrange one hour session. So 1 hour session where we can take only 3 or 4 topics. So any topic which you think is we are not comfortable and you want to discuss that topic in detail, you can please message me and we will try to cover those topics in some special sessions here, right? Take care of you guys and all the best for your studies. Keep working hard and the success will be all yours. Take care of yourself. Good night.